Could milk be bad for you? Why is that we sometimes advise patients with skin conditions such as acne, eczema, psoriasis, rosacea to stop drinking milk and stop eating dairy altogether? What is it in milk that could make you allergic or sensitive to it? Today we will be talking about dairy sensitivity, dairy allergy, and lactose intolerance. Those three concepts are often used interchangeably, but there are actually three different concepts that have different mechanism and different immune or actually non-immune mechanisms to them. So welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. So first of all, let's talk about goodness of milk, because when we grow up, when we're children, we're advised to drink cow's milk, and it is a good advice because it has lots of beneficial nutrients. In fact, milk is an energy-dense food. It has everything. It has proteins and carbohydrates and fats mixed with very important minerals and vitamins such as vitamin B12, B2, vitamin D, and potassium and phosphate. So it's essentially a great food. So what are the ingredients of milk? And we're talking about cow milk right now. So the ingredients of milk are whey and casein proteins. 80% are casein proteins, and the rest is whey proteins, and we will get back to whey proteins. But also, before we start talking about the concepts of dairy sensitivity and etc., let's talk about what are actually dairy containing products. And that's a little funny because sometimes in our clinic, when we talk to patients, sometimes patients would say to me, well, no, I don't consume any dairy, I don't drink milk. So, but milk is only one, well, the base component of dairy, but there's so many products that are made of dairy. So let's not forget sour cream, cheese, butter, yogurt, cream, the one that you put in your coffee, or a heavy cream, ice cream, and cheeses such as ricotta cheese, custard, pudding. And if you eat pizza, obviously you eat pizza with cheese on it. So essentially you consume dairy. So that's why dairy doesn't necessarily mean drinking milk every day. And a lot of adults don't do that. So, but we all consume dairy as part of our everyday diet. So let's talk about these concepts because it will help us to organize them and then discuss them in relationship with skin disorders, how they could cause or exacerbate a variety of skin disorders and actually cause rashes by themselves, just generalized rashes, as well as specific skin conditions. So the first thing is dairy allergy. Dairy allergy actually is a true allergy. It's not super common. We don't hear too much about it because it usually occurs in children. It's actually diagnosed in children, and it's about the prevalence of this allergy is 2.5%, and it's diagnosed in the first year of life. And usually it's just like any allergy. It could have symptoms that could be mild, could be severe, and symptoms, for example, could be wheezing, or could be anaphylaxis, which is a horrible breakdown of the whole body with loss of consciousness and etc. So with these types of allergies, the immune proteins that are in charge of that are immunoglobulins E. Immunoglobulins E, they work fast, and they basically, the parents usually know that the child is allergic very quickly because the child reacts to milk. So now, when we talk about dairy allergy in this context, we're talking allergy to cow milk. And then most of the time, not always, children outgrow of that dairy allergy. So we don't see it that commonly in adults. That's why I mentioned that you don't hear it as an allergy. So the next concept which we hear a lot is lactose intolerance. So now lactose intolerance, it's not an immune condition. It's not an immune reaction, as some people may think. The lactose intolerance basically is a deficiency of an enzyme that breaks down lactose, and that enzyme is appropriately called lactase. So what lactase does, it breaks down lactose into glucose and galactose. And if that doesn't happen efficiently enough, let's say if this enzyme doesn't do its job so well, doesn't take care of the whole lactose, or if there's a deficiency of that enzyme, what happens is that this lactose ends up in our colon, and then it starts being fermented there, and that's why we develop these unpleasant symptoms of bloating, of cramps, of abdominal pain. And these symptoms, they can come on anywhere from 30 to 2 hours after ingesting lactose. And is this type of lactose intolerance. Actually, I'm moving sort of to my next sort of subtype, is a primary lactose intolerance, when with time our body starts to produce less and less of this lactase enzyme. So that is called primary lactose intolerance, and a lot of us become lactose intolerance as we age, and we self-regulate by trying to not drink milk, and hopefully trying to limit the dairy products in our diet, because we can feel the correlation that we're not able to completely digest the dairy product. The enzyme that is lactase, as I mentioned, and the gene that is responsible for coding this enzyme is called LCT. And when we do a genetic test, and actually I think any medical genetic test that is done includes this evaluation for this enzyme, but we're talking predisposition to lactose intolerance, which as we age, we just make less of that enzyme, or it's less efficient in doing its job. There's also a secondary lactose intolerance, and that usually happens when we undergo surgery on our intestine, or let's say have a Crohn's disease, or some gastroenteritis, severe gastroenteritis, or in the conditions of leaky gut, where environment in our intestine, the gut dysbiosis, leads to a hostile environment for this poor lactase enzyme, and it cannot perform its duty. So, and based on that, so this is a secondary lactose intolerance. It's not it really is not talked about much, so, but it is very important. Then we also have the third sort of lactose issue or condition. It is called congenital lactase deficiency, and that is a rare inherited condition. It's a genetic condition, and obviously diagnosed in children, because that is applied to human milk as well. And it is a quite devastating condition in terms of diagnosing it when a baby is born and having all these symptoms, and it takes clinical suspicion to be able to diagnose that. In that situation, the baby is fed a soy-based formula, or basically non-lactose, lactose-free formula. So, but that's again rare condition. So we discussed dairy allergy, we discussed lactose intolerance, and a few more words about lactose intolerance. Lactose intolerance is diagnosed by several methods that could diagnose that. One of them by measuring glucose after ingesting a lactose-rich food. For example, you drink milk and then you measure glucose, because as I mentioned before, the role of lactase is to break lactose into glucose and galactose. I know they're all similar words. So if you have, so you measure the glucose to see how efficient the enzyme is. The other method, which is similar, is a hydrogen breath test. And again, you just measure hydrogen as a reflection of breakdown of this lactose, because again, lactose is component of milk. And there's also a stool acidity test. In stool acidity test, it's actually based on the fact that in babies, it's usually done in infants and babies, the stool is not supposed to be acidic. So if lactose is not being broken down, then in a stool of the baby with this condition, you will have a lactic acid. And by definition, lactic acid would make the stool acidic. So that also is extremely helpful and would be used for the diagnosis of these lactose intolerance. So what do we do in a situation of lactose intolerance? There are supplement enzymes. Again, I just want to remind that it is not an immune condition. It's a condition that involves the enzyme, the lactase enzyme that digests the lactose. So there are supplements for that, and of course trying to stay away from dairy, or there are actually more and more options at the supermarkets. I see the lactose-free dairy that actually tastes pretty good, I would say. I've tried them myself. So those are all good options to avoid that. And in a situation of secondary lactose deficiency, for example from surgery or from leaky gut, working at underlying or on underlying problem is the key to improve the function of that enzyme. So that's possible as well. So we're moving towards dairy sensitivity, and dairy sensitivity is the main topic that connects us with skin manifestations, because dairy sensitivity is an immune issue, and what happens is that our body starts producing immunoglobulin, IgG immunoglobulins, in response to casein or whey proteins that are part of the milk. And for some reason, some people become sensitized, and in some people they produce these IgG antibodies, and there are a variety of mechanisms how they could lead to several skin conditions such as acne, one of the most dairy dependent in terms of symptoms condition, but other symptoms such as eczema, psoriasis, hives, and more. We will discuss that in part 2 of this video. Meanwhile, thank you so much for listening. Until next time.